Good morning, my name is Mackenzie Hendricks and I'm Occupational Therapy Assistant at Arkansas Tech University, and today we're going to be doing a transfer in and out of the shower or tub, and we're going to be following posterior hip precautions due to your posterior hip surgery. So the first thing we're going to do is put our gait belt on, and this would be on the patient, and I would be assisting them by holding onto the back and staying mostly behind them, and I would help them get in and out of the tub. And how they would do the transfer is they would start standing in front, and if it was their right hip that had had the surgery, they would first use grab bars, and they would also be using a walker, which I do not have today, to get themselves up and in position. They would use the grab bars and they would hold on to the bench seat to sit themselves into the tub like so, and then they would transfer with their non-operative leg first, so they would put in the left leg. And when they transfer both legs, they will make sure not to raise their operative leg in above 90 degrees flexion, not to internally rotate or turn their knee inward while transferring. And when both feet are firmly in the tub, they will be placed flat on the ground without crossing legs or ankles to ensure these hip precautions. So what they're going to do now is extend the leg and transfer it inside the tub. A raised bench seat would be helpful for this so that they are not extending their knee or flexing their knee above 90 degrees. When they're in the tub, they'd be able to use a detached shower head like this to be able to rinse and bathe their body, as well as using a long-handled scrub brush with a loofah or a sponge or a washcloth at the end to clean their legs and their back without breaching hip precautions. Whenever they're done showering, they would exit the same way they entered, but with reverse steps. So they would extend their operative leg and remove it from the tub, sit flat on the ground, and then remove their non-operative leg. They would place both legs flat on the floor without crossing their knees or their ankles. And then by using the grab bar and pushing up from their seat, they would be able to stand. And they'd be able to use their walker for support once they're standing. Once they're done showering, to preserve energy, they could use the drip dry method so that they aren't trying to twist and waste energy drying their bodies. They'd be able to just sit in place and dry. And then they would be able to use the sock aid, shoe horn, reacher, and dressing stick to dress themselves afterwards.